Hi everyone, my name is Joshua Valencia. You guys can call me Josh for short. And in today's disorder, I'll be talking about attention deficit hyperactivity disorder. Okay, the description or definition of attention deficit hyper disorder, or ADHD for short, is defined as a combination of persistent problems such as difficulty paying attention, hyperactivity, and impulsive behavior. So the DSM-5 code would have for hyperactivity this or ADHD would be 314.1, and the ICD-10 code would be 590. No, I mean F90.2. It's with a that has a combined type and a sub moderate severance, I believe it's called. Yeah. So what are the symptoms of ADHD? Some of the symptoms of ADHD include often having difficulty sustaining attention and tasks or activities. This could include things like has difficulty remaining focused during lectures, conversations, uh, or lengthy reading. Another symptom is often does not seem to listen when spoken directly. This can also mean like um, mind seems elsewhere or even in the absence of any obvious distraction, um, not following through instructions and finish homework, chores, or duties in the workplace, like starts starts tasks but quickly loses focus easily and or sidetracked. In other words, difficulty organizing tasks and activities. This can include like things like managing sequential tasks, difficulty keeping materials and belongings in order, messy, disorganized work, or has poor time management, or fails to meet deadlines. Let's see, often forgetful in daily activities. Like an example of that could be school materials, pencils, books, school tools, wallets, key, anything to avoid um, something that the person's not really interested in. Other symptoms include often fidgets or taps hands or squirms to see. Often will lose things to avoid tasks or activities, like I mentioned before. Let's see. So one of them, Mr. Case study include. So if you want to read the case study first, go ahead and pause this video, and I'll let you decide on that. But for the diagnosis, uh, for the case study, I chose um, the DSM-5 code 314.1 and the ICD code 5F90.2 with attention deficit hyperactivity disorder combined type with moderate severance. Since Mr. A has been showing at least a minimum of six symptoms that's included in the case study, and has been experiencing these symptoms at least 6 months long long or throughout his life. That's according to the DSM-5 textbook. Okay, current statistics, prevalence, and prognosis. For prevalence, I put according to DSM-5 textbook, a population survey suggests that ADHD occurs in most cultures and in about 5% of children and about 2.5 in adults. Adults and males are 3 times more likely to be diagnosed with ADHD. That's supposed to say 13.0% than adult females compared with 4.2%. Statistics in the US alone can estimate a number of children diagnosed with ADHD in 2016 was about 6.1 million children. 388,000 children from the ages from 2 to 5 years old, 2.5 million children aged 6 to 11 years old, 3.3 million children aged 12 to 7 years old. And boys are more likely to be diagnosed with ADHD than girls, 12.9% compared to their 5.6%. For treatment, there's only 2 treatment that I was able to look into, which the first one would be behavioral therapy. Since it's the first, would be the likely be the first treatment option. Duration of the time would include like the 30 to 60 minutes. Cost about $8 to $288 a month. Success rate 69.3 to 75% effectiveness. Medications. Oh, for behavioral therapy, that usually involves learning techniques to help improve organization, completing tasks, time management, and strategies to impact and strategies to improve impulse controls. For medication stimulus, success rate is about 80% effective. Cost will depend on the patient's income. Duration, well, the medication is usually taken 2 or 3 times a day. So with stimulants, helps increase dopamine levels in the brain. That helps the neurotransmitters associate motivation, pleasure, attention, and movement. With patients with ADHD, though, stimulant medications can help boost concentration and focus while reducing hyperactive or impulsive behaviors. These are my references. Yeah, and that's pretty much it with my slides. Thank you guys so much for taking the time to watch this short video. Take care and have a nice spring break.